Dr. Gaither, I think we're ready. I can read housekeeping when we.
Okay, yeah, go ahead. Let's start with housekeeping, then we'll call the meeting over.
All right. Colleagues, please be advised that this meeting is being recorded. So anything viewed on the webcam, anything posted in the chat will become part of the recording. We're also, if you're online, if you hover your mouse over the bottom, there should be a on and off for the audio, and on and off for the video, and then of course leave the call. Julie and I will be monitoring the chat box for questions. For everyone's benefit, if you could identify yourself before stating your remarks, that's helpful for the group. If you're attending by phone only and you're having trouble getting through, try hitting *6. Thank you for your participation and your patience.
Thank you, Shelley. Let's go ahead and call the meeting to order. I'd like to start with roll call.
All right. Allison Welch.
Present.
Amber Prince. Candace Williams. Candace, I see Candace on the.
Is the audio okay? I think we might need to speak closer to the microphone just to make sure people can hear us.
Is Candace Williams on the call? Carrie Lewis.
I'm here.
Dale Woolridge. Dale Woolridge. Darth Gamer.
Present.
Heather Miller. I'm here. Declan Kurth declined. James Cicilline declined. James Cunningham. Josh Gaither.
Here.
Julie Augenstein. Julie, are you still on the phone, on the call?
Yeah, can you hear me?
Yes, ma'am. Laura
Hello?
Smith.
Can you hear me? Hello?
Laura Smith. Melissa Moyer.
Hi, it's Laura. I'm sorry. I'm here.
Oh, thank you. Melissa Moyer will be absent. Michelle Gladnola.
Present.
Pam Noland. Paul Dabrowski. Ralph Kelly.
Here.
Ray Proa.
Present.
Rebecca Harrow.
Present.
John Boker's absent. Tiffany Streever. I heard you.
I'm here.
And then Tom Flanagan.
Candace Williams is here. My microphone wasn't working.
All right.
I count 13. Yeah, it looks like Sandy Nygaard had her hand up. Sandy, did you have your hand raised for something?
No, I must have did it by default. I apologize.
Okay. Thank you.
All right,
Yeah,
perfect.
quorum.
Thank you, Shelley. I think we made it. Let's start things off with the chairman's report. It's fun to be back in person. So it's, for those of you joined virtually, our Tucson group actually made the trip up here. We survived the rainstorm. We're happy to be here. Let's take a moment to glance at the attendance report. Just a friendly reminder, please make every effort to attend or let us know if you're unable to attend so that we can ensure we reach quorum for each meeting. If you miss 2 consecutive meetings, the Bureau will reach out to contact you and ask if you're still interested in serving on this committee. There is one vacancy to note, the Air Ambulance Premier EMS Agency Quality Improvement Officer position does have opening. If you are interested in fill that spot, please let Shelley know. With that, let's take a look at the 2022 meeting schedule. Believe it or not, it has been since 2020 that we had an in-person meeting. Take a moment, glance at the meeting schedule for 2022 and mark those dates for the meetings. With that, I have no other items to report on. I'd like to turn it over to the Bureau for an update from the Bureau staff.
Right. Well, good morning, Dr. Gaither and committee members. This is Rachel Garcia from the Bureau of EMS and Trauma Systems. I agree with our chair, Dr. Gaither. It is very nice to have an in-person and virtual option for our meeting this morning. Thank you, Shelley Bristol and Dr. Gale. We appreciate you guys setting this up. So I have a few department updates. I'll talk a little bit about our budget and staffing. The state budget has been approved. And with that, the Bureau's budget this year has had a slight increase, but we continue to monitor funds and we expect level funding for this year compared to previous years. Regional funding appropriations have also been approved, and we have pushed out contracts to all the regional councils with level funding compared to previous years again. We still have several vacancies within the Bureau, and those vacancies, including a position on education and training, are posted on our state jobs website for review. Last month, we welcomed new hire Travis Connors, a project coordinator in the Bureau, and we will welcome and introduce him today as well during today's meeting. On the COVID front, Arizona's reached a new milestone in pandemic recovery, and I'm sure you've heard that the governor has rescinded several COVID-19 executive orders. Currently, executive orders that implement enhanced surveillance as well as the surge line remain in effect, and the department continues to monitor data reporting from hospitals and labs as well. It's still recommended to receive vaccination as the best form of protection against some of the variants that we are seeing detected in Arizona. And I'll add that the Bureau is working closely with ADHS licensing to also update a current policy statement on the use of EMCTs in hospital settings. With licensing of hospital at home programs on the heels of the pandemic, we would expect this guidance to follow the use of EMCTs in traditional hospital settings, including requirements for scope of practice and medical direction. A few more updates on rules and scope of practice. The department continues regular rulemaking for both ground and air ambulance rules. We have new drafts of both air and ground ambulance rules that are available on the azhealth.gov website for comment through August. The informal draft process for both air and ground ambulance rules are expected to continue through 2021, with plenty of opportunities for additional informal comments before those drafts move forward to the formal process. Our EMS scope of practice update recommended by the Medical Direction Commission has been sent over to the governor's office, and we are still waiting to hear back. Scope of practice updates follow exempt rulemaking, and we still have several pending requests regarding exempt rulemaking. So we'll keep everyone updated on that. I believe that is all I have for now, pending any questions.
Thank you very much. Let's then turn to, I believe, Travis for the next report. Public Health Initiative.
Travis, are you on the call?
Maybe we
Yes,
will.
hi, can you hear me?
Yeah.
Yep.
Okay, sorry, it's having problems unmuting myself. So my name is Travis Connors. I am new to the Bureau. I came from the medical marijuana program at the Arizona Department of Health Services. I was recently a program manager for that program over there. So my new role here is going to be a project coordinator focusing on the public health initiatives, as well as looking for, any type of improvements in relation to efficiency and productivity within the department in terms of standard work, or even modernizing some of the services and web pages services we offer. With that being said, a recent update we currently had was effective July 1st of 2021, the Bureau transitioned to a fully online EMCP certification process, which included the issuance of digital certification cards. Now we have an announcement on our homepage, as well as the EMCP certification home webpage as well. There is a updated frequently asked questions FAQ, and that is provided in a hyperlink on the announcement page as well. Starting on page 6 is where the new sort of standard working and kind of questions related to the electronic cards and digital certification process lie. So if you have any questions regarding that process or how to produce the electronic card within your EMS portal, please refer to the frequently asked questions. Additionally, I'm also here if you need to ask any further questions or need clarification, and as well as providing feedback on the FAQs as well. We're always looking to improve what we currently have. Are there any questions related to the electronic cards and the digital certification process? Okay, fantastic. If you have any questions and don't feel comfortable asking in this environment, please just reach out to me. My email is Travis, Travis, period, Connors, CONNORS, @azdhs.gov. And thank you very much for the introduction. Appreciate that.
Thanks, Travis. Let's turn it over then to Dr. Bradley for an update on a few different topics, the blood products and Leave Behind Narcan program.
All right, thank you very much. So I just wanted to give a brief update to this group. This committee had many participants in the STAB subgroup, which looked at information for the field use of blood products. That was presented at the last STAB meeting, really more of an informational kind of state of the state in terms of where we are in Arizona with current blood product utilization, in terms of who can administer it, where it sits with scope of practice and drug tables, and a really good discussion. So that was presented at STAB. And if there's any questions, please let me know. But I just wanted to circle back to this committee, especially with the trauma component here. So that was presented at the last session of meetings. Any questions regarding that? All right, hearing none, I will move next to the Naloxone Leaf Behind program. I'm sure if anyone has seen any of the news lately on a national basis, there is a lot of information coming up about the large increase in opioid overdoses nationally, including opioid overdose deaths over the course of the pandemic. Now that we're kind of fully into 2021 and people are able to really look at their 2020 data, we have seen a big increase in those numbers. One of the programs that started out small in Arizona, but we're really trying to promote at a statewide level, is the Naloxone Leaf Behind program. This gives EMS agencies the ability to distribute naloxone to patients, bystanders, family, friends of individuals at risk. And we wanted to really start getting that messaging out. So you'll probably hear this message quite a few times. We plan on doing a little bit of a roadshow, making sure this goes out to all the regional councils. We'll keep presenting this as well as standing and statutory committee meetings. We are trying to make this as easy as possible for an agency to implement. There is a standing order for naloxone that is under my name for EMS agencies for this program. In addition, we have a link that we can provide to the Office of Injury Prevention. EMS agencies can apply and get free naloxone to utilize this. This is the prepackaged commercial intranasal naloxone. So it's the 4 milligram dosing, two doses in one package. Education Committee has also put together a training curriculum that will be going for approval later today. That will get posted hopefully within the next week. That would really allow you to essentially download an educational PowerPoint, a pamphlet that you can customize specific to your jurisdiction in terms of resources for medication-assisted treatment or other options for overdose patients, along with the standing order. So we just wanted to bring this messaging out and make sure that everyone was aware that this is an option in Arizona covered by statute. Any questions regarding the Naloxone Leave Behind program? All right, next I will hand it over to Julia for a brief update on SHARE.
Good morning, everybody. I think the biggest update for SHARE is that the Bureau is in the process of recollecting documents from cardiac receiving centers and referral centers across the state. There have been a lot of questions about this process, and just to reiterate, it's not a new process, so they haven't been collected in a while. So if you have any questions about that, feel free to reach out to myself or Dr. Bradley. Also, Bruce and AEMRC staff are currently in the process of reaching out to hospitals that have missing data so that they can complete the SHARE report. So that's also going on. For EMS for Children, we're currently in the midst of the National Pediatrics Hardiness Project assessment. We have 26 hospitals that have completed that so far. It was just extended this week to August 31st. So if you're in a hospital emergency department, I would encourage you to participate or identify the person that should participate on behalf of your hospital and encourage them to do so. We're in the process of hiring for a new EMS for Children coordinator. We have somebody identified and they will hopefully be starting in September. So that's very exciting. And lastly, I'll just mention that we did apply for some additional EMS for Children funding and should hear back about that in September. So we'll keep you updated on that. That's all I have.
And if I can just add it in regards, we've gotten some questions from hospitals. We figured this group especially, we have really good participation from many of the pre-hospital managers as well as overlap from many of the smaller facilities that cover both trauma and pre-hospital coordinator position. Really, we wanted to make sure we collect documents for the SHARE program for the cardiac receiving center and referral center. So I know that there's been some questions. We are going by the list that U of A has in terms of data collection. And so we just asked that if there's any questions, these were the things in order to apply for the program initially over a decade ago, what you had to test and provide the documents for. We're really just trying to say if we're going to ask EMS agencies to potentially bypass a closer facility with a cardiac arrest patient, that we make sure that you still have these policies and procedures in place. So we're doing this more from that, making sure that we have these in place. We're not going to be going through your policies and asking you to make changes, but certainly just trying to make sure that we actually have these available for you guys to look at. So please send us those items as soon as possible. If you have any questions, please reach out to either myself or Julia. Any questions about that program?
Thank you very much. Next on the list is Batzel for an update on the data dashboard.
All right. Good morning, everyone.
Good morning, Batzel.
Good morning.
Thank you. So the dashboard page, we have updated a little bit. All the data is also now updated for the year of 2019, and will pretty soon now 2020 data for the trauma dashboard also will be added. So as you can see on our, I don't think so we need to go into individual dashboard. Let's just keep the main page, because go to the home page, right? And as you can see, we have trauma injuries by year. That is our trauma annual report. Then under the trauma, we talk about motor vehicle traffic accidents. That's the next dashboard. So it goes into detail of that injury. And the falls is again based on the trauma, that our first main mechanism of injury. So that dashboard is there. And each dashboards are up to date with the data what we have in our registry. And the EMS incidents by year, that is the EMS annual report, which you will see. So it kind of reflects annual report. When I say annual report, it's not everything is not there, but it gives you an overall picture of our AZPS registry. And then the last dashboard we have is ASTR trauma injuries by racial and ethnic differences. And so that's by race and ethnicity related trauma differences. We are planning to add a couple of more dashboards, and as the 2020 data comes, we will again update all the dashboards based with the 2020 data. Any ideas? I mean, you guys have for us to develop any other dashboards? Please send me an email.
Thanks, Vatsal. I did have one quick question, if you can. This is beautiful, quite frankly. I was clicking over to the fall dashboard. I would encourage everybody to click through them. They're graphically quite pleasing if you're OCD, I guess, like I am. My question for you, Vatsal, is has the Bureau looked at changes in things such as the percentage of falls that account for all trauma? So in other words, if you look at the graph under falls, very nice graph illustrating that the number of falls has consistently increased every year over the last 3 years. Is there any way to show that falls have remained at a stable rate or increasing or decreasing over that time period?
So you mean to say you are saying that we remove the rates of fall and look at it over the years? Is that what you are suggesting?
Correct. I think from a I think perhaps public health perspective, it would be interesting to say our fall rate has stayed the same over the last 3 years, or we have seen a significant increase over the last 3 years in the rate of falls resulting in serious traumatic injury. As purely not something for today, but in the future, that may be something interesting to include in these dashboards that would make the data digestible in a quick glance and more actionable.
All right, that's a good idea. We can look into it. I know the fall cases are increasing. If we see in our registry, there is a little bit of limitations with the trauma registry is the way we capture data, because fall, one thing is that we do not capture all the falls, like the same level falls are excluded. And so it depends upon the subjectivity of the registrars, which falls gets entered into the registry. So sometimes that subjectivity gets into the bias of our inclusion criteria. So we have to just keep that in mind when we look at the falls picture in the trauma registry.
Absolutely. Thank you for the clarification. And again, this is amazingly cool data and very well done. So thank you.
Thank you.
Any other questions for Vatsal? Okay, moving on then. Next is Anne with an update on the Premier Agency Peop program.
Good morning, everybody.
Hi, Anne.
Hi.
I'm going to stop sharing my screen.
Good morning, Em.
Good morning. I need to present my entire screen. We'll see how it goes.
And we're having trouble with your audio.
Oh, can you hear me better?
Yes, ma'am.
Okay.
You're going to share your screen, correct?
Yes. Okay. Can everyone see my screen?
Yes.
Yes.
And is it large enough? I blew it up beforehand a little bit, hoping that it would.
Looks good.
Can you see it? Okay. And this is not going to be as pretty as the dashboards. It is just an Excel table, so I apologize. We got to create this, but it is not as pretty. But hopefully it'll help convey the message. So as you all know, we have an updated Peop standard that has been approved as far as data and data. And so this particular
request that sorry to interrupt. I'm going to request that Vatsal mute her microphone, please. Okay, continue.
So this is just an updated validation score spreadsheet for just Peop agencies. So I don't remember what month it was, but a while back, Ben Fisher kind of presented something showing the current state at the time before the standard was approved. So now that we're a few months in, and we wanted to look at the most recent month of data for Premier EMS agencies and kind of see how it looked. So this is June 2021. It is blinded by agency. So this agency number is not traceable back to an agency, and it's blinded by vendor. And we did a volume range, so it makes it more comparable when we're going to look through this really quickly, but it also kind of hides exact record counts. And you can also see on the column B, the level is just air or ground to kind of give you an idea of the different types of agencies in this table. So I'm just going to scroll through. You can kind of see it's in order of volume range, largest to smallest, and then validation score. So we have the greater than 1,000 runs per month. And we have 500 to 1,000, 100 to 499, and 1 to 99. And I realize I went through this kind of quickly, but I'm just going to scroll back up so you can kind of see that there's only 7 agencies that currently in June have a score of less than the median of 90, which is the score that was set for the Premier EMS Agency program. The score doesn't have to be met until March 1st, 2022, but it kind of shows you that we really have almost all of the current Premier EMS agencies meeting that standard right now. And several of them have come up to be within the standard in between the last time we discussed this and now. You can also hopefully see from this, from the volumes, that the different volume levels are unrelated to the ability to achieve a median score of 90. So we have a couple that are over 1,000, and then we have some in the 100 to 499 of different types, so ground or air. And then actually the lower volume agencies, there aren't any that aren't meeting it. So that's kind of, I think, an important thing to look at when we think about if this standard is something that the agencies can meet, depending on volume type. And lastly, just one little thing I kind of want to mention. I didn't do an additional table that I'm displaying here for this, but we did make sure that for vendors that have more than one client participating as a Premier EMS agencies, the scores are not vendor dependent. So the scores that the agencies are receiving are unrelated to what vendor they have. All the vendors have at least agencies, either all high range or high and low, but none of them are just in the low range of scores. And so I'm going to go back up to the top so you can see the headings, but is there any questions that anybody has on this, or?
And this is Garth Gamer here. First off, thank you for putting together this nice illustration. The immediate question is, are there any commonalities with the agencies that didn't achieve the 90% threshold?
No, there's not, which I think is a good thing. They don't have the same volume necessarily. They don't have the same vendor. They're not always the same agency, you know, air versus ground. The time that they have been participating as a reporting agency varies. Some of the agencies that are low and high have been on for quite a long time. Some of them are newer. They're all Peop agencies, so they would all be ones that have been approved to participate in the program. But no, there doesn't really seem to be anything that sticks out. Some of them I think are volunteer, and some are municipal, and some are, like I said, smaller and larger. So it doesn't seem to be dependent on that.
And drilling down to individual data elements, there doesn't appear to be any specific one that is more common than others. It just is kind of a potpourri of omissions and things that get people under 90%.
I haven't done an analysis where I can give you numbers, but in my experience looking at the different reports we send out every week to the agencies, telling them what validation rule errors that they have, the agencies with lower scores tend to be missing some of the more valuable data elements that have higher point score issues. So there's certainly some that are missing a lot of lower, point ones. For example, race is not filled out as often as many others, but that's only 1 point, so that's not going to really play into this. They seem to be agencies that are missing either primary impression completely, or they're missing whether it's a cardiac arrest or the narrative completely. Things like that, and maybe several of those that are playing into the scores.
Thank
And,
you.
quick question, how many PEP agencies are there currently?
Let's see. I think I'll literally have to subtract what I've got here. That doesn't mean if somebody for some reason didn't have their data in June, then that could be a problem. But
Approximate.
yeah, I know. I'm like, I'll just scroll down. It's about what, 67, 68 Premier EMS agencies. And the thing too is the Premier EMS agencies listed on the website are, some of them applied under a name and then were later absorbed into another CON and that kind of thing. So that's why I have to hesitate a minute, just because they're in my database. For example, if they're CONs combined, they're now just one agency reporting in mine, even though they may be listed as two separate ones at the time on the Premier EMS agency website. So.
This is Dave. There should be 72 Premier agencies currently.
Okay. Yeah, I think there's a couple that, like American Comtrans, which are no longer reporting separately because they were absorbed, that I list as one reporting agency, but probably are broken out on that. Well, David, you and I can look later, but I think that's when I looked last time, kind of trying to compare numbers. It was because they had applied under a previous number or CON.
And I think just a reminder, Anne does send out the reports constantly in terms of each agency regarding where the errors are and where they're getting that lower validation scores. So if an agency is below, they are getting notified. How frequently, Anne? Is it weekly or monthly?
So the individual errors come out every single week and look back 2 weeks. So if for some reason something gets fixed, it'll be reflected. The monthly report where each agency gets their median validation score, and they get kind of ranges of, like, you have 7 runs that are 80 to 100, and you have 12 runs that are in the next category down. That comes out monthly on the 1st of the month. And if anybody isn't getting those reports, please let me know, because it's possible, I can't build them until an agency starts reporting, and they're built individually. But then also sometimes we have turnover in agencies, in people in different roles, or someone retires, and those reports are going but not reaching anyone who needs the information.
Excellent, thank you, Anne. Any other questions for Anne? Okay, 2 more agenda items that I believe we have already covered, but correct me if I'm wrong. We have data request information and digital certification starting July 1st. We've covered those?
I do believe there was a question in the chat from Dr. Damer. I don't have access to the chat, but I believe the question was along the lines of, is the emergency declaration still in effect? And the answer is yes, the emergency declaration remains in effect. It is necessary for us to maintain that emergency declaration while we're still pulling down federal funding.
Thank you very much.
And I think there was a link, I believe, to the data request information. This was a follow-up from the last meeting from a public comment. There had been a request regarding how to request data. And so we wanted to just make sure that people knew. So that link is provided if you're online in the agenda. There's a live link to that. It's on the Bureau webpage. It kind of goes through the process of how to request data. I know there had been quite a bit of questions in the last public comment section, so we wanted to make sure we brought that forward and did work with the stakeholder to try to address their request. But again, there are specific elements. If you are going to request any data from AZ peers, you have to kind of demonstrate several items in order for any data to be released. So that process is all outlined, but we wanted to make sure for completion's sake that we put this on the agenda for everyone to see.
Okay. Thank you very much. Let's move on to our discussion and action items. The first item listed is to discuss, amend, and approve the draft minutes from March 18th of 2021. So I have a motion to discuss, amend, and approve.
Rebecca Haro makes a motion.
Thank you,
Second,
Rebecca.
Garth Gamer.
Thank you, Garth. Please take a moment to review the meeting minutes. Any questions or concerns about those? Okay, hearing none, I'll call for a vote. All those in favor of approving the minutes as provided without changes, please say aye.
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 Any opposed, same sign. Okay, minutes are then approved as listed without modification. Let's then look at agenda item B, which is a standing agenda item to discuss the sequence for discretionary reports. This is an attachment 5B and shared with you on the screen. I did want to take just a minute to read through these, as I think we've kind of lost track of them during COVID, which is totally fine. What did catch my eye is the 7th bullet, which is evaluating missing EMS Trauma Registry data fields in the Cactus data set. I believe that no longer exists, so we should probably remove that as a bullet point. Any other suggestions or things to look at? I believe this does probably overlap well with Vatsal's data presentation earlier in the meeting. I think my other proposal would be to look at bullet number 2, which relates to the safety of airway management and COVID. Unless someone is interested in a research project, I don't know that that has much ongoing value, so I would propose to remove that bullet also. Anyone else with thoughts or suggestions regarding this list? This is not a voting item, so I don't think any further action is necessary at this time. Hearing no other suggestions or concerns, let's move to item C, which is to discuss NMSIS 3.5 timeline. Anne?
Hello, everybody. So I don't really have much to update as far as the V35 timeline. Currently, vendors are testing with NMSIS or in the process of scheduling their tests. So as far as I'm aware, there's no vendor in the state as of this week that has 3.5 compliance, which is fine because that's actually, I don't think there's hardly any vendors nationally that do, so that's not unusual. The tentative date, I'm hoping to open up Easy Peers to allow 3.5 submissions. So basically an agency would need to make sure before they went to 3.5 that the state could accept 3.5. And that doesn't mean that we would force direct users to move over to 3.5, but just that we would be able to take in that data. I'm hoping by somewhere at the end of 2021, we have to wait for the product to be ready. We have to do the setups and the testings and that sort of thing. And the NMSIS deadline, which I haven't heard any news about it being extended, will shut off the current version we're submitting, which is 3.4, on December 31st, 2022. So on January 1, 2023, NMSIS expects the states to have transitioned to version 3.5. And my hope with this timeline of allowing data in for Arizona users by the end of this year and the deadline to change over by the end of that next year. My goal is to have everyone over by November because we all know that November and December can be crazy between holidays and leave taking. And the last thing I really want to do is have something go live January 1st. But so I have a tentative goal of having everybody moved over by 3.5 by sometime in November of 2022. But I'm hoping that year gives everybody time to prepare, to discuss with their vendor. I'm trying to keep updated on kind of the vendor timelines. If they've given them to NMSIS, they've posted them on the website. I think it's a reasonable timeline. It's certainly not as big of a change as there was from 2 to 3, if anybody remembers that. It is a larger one than we had from 3.3.4 to 3.4. That one, I don't think people really even noticed that we did. So it's somewhere in between. I know there's an update in a little bit that someone's giving on the last EMSREG meeting. And we did talk in that meeting, and there's minutes online, about some of the highlights that are coming in the V35 transition. And there's some really, really good things that are coming with it too, so that were causing issues in the current system. We do have a timeline too on our website. that someone put together, Julia did, and it's lovely. If someone would like, I can refer to that. Do you want me to share my screen and show where it is, or do you want to go to it? Maybe Shelley, it's on the.
If you could share that, that'd be great, Anne.
Yeah, sure. Let me do that.
Thank
you. Yeah. Give me just a second to get to the right page so you guys don't have to see all the other maneuvering as I have. Okay. All right, so let me share my screen again, please, Shelley. I don't want to jinx it, but I feel like I'm so much better at this than I was a year ago. All right. Less technical difficulties when getting things to show. So let me see, where is my, yes, okay. So can everyone see the Bureau of EMS and Trauma System webpage?
Yes.
Okay, great. So under there, there's a data quality and assurance subheading, and within that is AZ Peers. So if you ever bookmark the AZ Peers public-facing website on the ADHS, this is where I put a lot of the documents that are good reference materials if someone's interested in them. On the very first tab, there's Getting Started. You're welcome to poke through the other ones too at your leisure. And oh, there's the MSRG one that has the minutes on it too. There is the V35 transition timeline. And there's also some other really great links down here, by the way, of like, where does your data go, and understanding how the HIE works and things like that if you're interested. I want to thank Julia again for putting this together, because she's much better at visual presentation, things like this, than I am. So even though it has my name on it, it's not my work. But this, hopefully, like I said, this is tentative because everything is like a domino. We have to wait for the vendors to be ready, for us to set up, for agencies to set up, to send the data. But this is our timeline as it stands. And this was also communicated in the April MSRG meeting to all the EMS agencies that attended, and the minutes are available for those that could not be there. And vendors are also welcome to attend that MSRG meeting and got the minutes too, so.
Thank you. And I think I wanted to just, before when we've gone live with changes, we've really tried to give people ample timing and warning. So this is kind of for this committee that oversees our data for the state. Just wanting to make sure that everyone is aware that it's really a NEMSIS deadline, January 2023. That sounds really far away, but that's less than a year and a half. So just making sure that everyone knows that really 2022 is when this transition will have to occur in order to be data compliant. So just as we start seeing these timelines, it's amazing how quickly time goes, especially since COVID. I feel like you blink and 6 months have gone. I wanted to make sure that this is put in front of everyone. So keep that in mind. January 2023, 3.4 is likely going to be ending because we can't put that data in NEMSIS.
And just one more thing. I mean, as always, please, if you have questions, if you are an agency or even a hospital and you have concerns, or would like some resources, or see if there's a document out there that you can kind of, cut up and use for yourself as opposed to having to reinvent the wheel, please do let me know. I have a lot of resources available. If I don't, I might be able to create something. NEMSIS also creates a lot of things for states and for agencies if we request it. So especially if you can give me a little lead time, we might be able to get you what you need, so that you don't spend all of your time working on things that we can provide for you. Thank you.
Okay, thank you very much, Anne. Any questions regarding the NEMSIS 3.5 transition? Okay, we'll move on then to the next item, which is to discuss trauma center designation during the COVID-19 pandemic and extensions and postponed site surveys.
I think we just kind of a brief summary of this. We understand that with COVID, there were extensions made for by ACS, which has kind of affected some of the timeline with our trauma inspections, specifically for level 1 and 2 facilities. We have a big thank you to Dr. Patel, who has been working with Chief Garcia and myself, trying to look into options of working with ACS. Dr. Patel, I don't know if you're on the line still. I think you were able to join us. And if you can give any brief summary of where things are at ACS level. Dr. Patel, I do see you still online. If you're trying to speak, you are muted. Oh, no, we cannot hear you.
Let's try again. How about now?
Yes, we can. Perfect. Thank you.
Okay, sorry about that. I think there's an echo and I'm not sure why.
You sound good. Yeah.
Sound good.
So from the ACS perspective and what the DHS has been working with, we are currently working with the ACS COT to see what allowances they can make with respect to the 1-year extensions that were granted because of COVID, as it pertains to verification. And the area we're looking at that in is specifically our centers in Arizona that will designate at a different level than they are verified. So basically our level 2 verified centers who are going to be requesting state 1 designation. So that's currently with the college, and we're waiting for feedback from them as to whether they will be able to be the quote unquote required national verified organization that has to partner with the state. So that's currently where we're at. But Gail, I had, if possible, a question regarding the logistics of that and what we had discussed regarding rules and what the state can actually do with respect to affording extensions for designation.
Perfect. I will hand that to Chief Garcia.
And Dr. Patel, this is Rachel. Did you have any specific questions or just in general regarding our rules and timelines?
So yeah, just a specific question, Rachel, and this came up after our conversations and talking with some of our other stakeholders, and they seem to be an impression out there that if a center's designation is lapsing, the ACS has granted a year extension, so we're now out of sync, that the hospitals were going to have the ability to file a full application. And then there was potentially the ability of the state, once that's filed, maybe give a 6-month extension such that you could go back into sync with the staggered ACS delay that's occurred. And I know there may be other stakeholders on this call that know more about that than I do. So I just wanted to bring that to the table as our discussions are occurring with COT.
Yes, Dr. Patel, I think it's really important that we consider that some of these extensions could have potential for changing the timelines for applications, review, and surveys. What we're looking at and what we've talked through with many of the trauma centers is for level 1 designated trauma centers that are also verified as level 1 ACS trauma centers. We've been able to stay on the same timeline and allow that 1-year COVID-19 extension that ACS has granted to those facilities. The trauma centers that are seeking a designation that may be different than their ACS verification level, that's where we want to make sure that we're doing our due diligence to follow up with those facilities and to try to get everyone on the most appropriate timeline possible so we're not throwing anyone off by 6 months or more. So we're happy to talk through that a little bit more for some of the facilities that fall within those categories. Does that answer your question, Dr. Patel? I know it deserves more conversation.
Sorry, can you hear me, Rachel?
Yeah. No, we can.
Yeah, I'm sorry, folks. I'm having audio issues. No, that does help. And the only thing I was trying to allude to, Chief Garcia, was it appears that there are conversations that may have occurred before our transition. And I don't know if there are any other stakeholders that can articulate this better than I just put out, or whether this is something you would rather we defer for a different conversation.
And Dr. Patel, I don't know if there are any other comments on the line, but yeah, we'd love to have a follow-up conversation on this topic to make sure that we're understanding it better, especially as I'm newly transitioning into this role, and we understand that many of these extensions were granted, as the department has gone through leadership transitions as well. So we would welcome having this conversation during future meetings as well, or as separate follow-up as needed.
Okay, thanks very much. Let's move on then to discuss the timeline for the 2021 EMS annual report and STAB report.
All right, I'll take that one as well. We wanted to throw out there that this is the time of year that we begin to review the data in more detail as we prepare to put together the 2021 EMS and STAB annual reports. We understand and recognize that as we look backwards at 2020 data, that it was quite a time frame. And as Dr. Gaither mentioned, we want to make sure that we are looking at the data in a meaningful way, considering not just raw counts, but perhaps percentages, rates, things that help us to better understand information as we've had changes over time in reporting and changes in health behaviors and use of the healthcare system as well, especially during 2020. So with that, I just wanted to mention that the team is beginning to look at this information. My understanding is in past years, we typically publish our annual reports during the the second quarter of the fiscal year. So that would be after October, typically, that we're looking at for publishing an annual report. We wanted to see if there were any questions, comments, or special considerations for trend analyses as we start to look at the 2020 data. On our side, I will tell you that we are starting to think about a pandemic preparedness and recovery supplement that may help us to look at some of the trends that we feel are out there, especially related to education and workforce that may have been impacted during the pandemic.
Thanks. Maybe I'll lead off with one suggestion. At least when we look at our local data for 2020, we found it very helpful to overlay COVID data on top of all of our reports. For example, if you overlay COVID data on a cardiac arrest survival curve, it's pretty clear to see how the COVID pandemic impacted that. It's remarkable how well those graphs overlay. So something like a prevalence or COVID death rate overlay on each graph may help to better graphically display how COVID impacted cardiac arrest survival, opiate or Narcan administration, those types of things normally reported that are almost surely to have been impacted during the 2020 year.
And just to clarify, are you kind of thinking like the COVID numbers, kind of like the two surges that we see of actually just case volumes, and looking at those and overlapping them?
Yep.
Okay.
Exactly.
Perfect. Great suggestion. Thank you. So we do continue to monitor at a constant basis the out-of-hospital cardiac arrest data. And so that is something that is really, we definitely have seen numbers much higher. We've seen those numbers persist into 2021 above previous years. We will continue to monitor those. And Vatsal and her team do a really good job adjusting for population change. I think we'll have to try to see, Arizona seems to be a hotbed for influx of population, so certainly we do need to adjust for that. And then we do have the addition of Phoenix Fire as they've gone live with ETCR, and so that has also significantly increased our data into ACQs as well. So there will be some big transitions, I think, both for this annual report and the following one. Just as we see both of those items will affect some of the data trends. So those will be really clearly annotated on there. Any other specific requests regarding those reports? One of the things, I think I saw one annual report come up before COVID. That was right after I started here at the Bureau, both Chief Garcia and I have some ideas of how we'd like to see that potentially change a little bit. So if there's any feedback from the community and across the state, we'd really like to hear that.
A purposely long pause. Any suggestions or further comments? That ends our discussion and action item agenda. Let's move to updates. Melissa, can we get an update from the Trauma Registry user group?
It's not in
Right.
it.
Oh, sorry. Sorry, this is Carissa Wilson. Melissa is not able to be with us today, so I will be giving a quick update on TRUG. For those of you who don't know me, I've taken over for Mary as the Trauma Database Administrator. So a few things from our meeting in April. So registrars who enter in a full data set currently use AIS 08 codes to record injuries, and we'll be moving to AIS 15 at the start of January 2022. So we made sure and let the hospitals know that those who are not on the web version of Trauma One will need to get that update before January 2022. So does anyone have any questions on that? Okay. And if anyone has any questions afterwards, feel free to reach out to me. Another topic that we touched on, Trauma One generates 2 injury severity scores. One is generated from AIS codes and one is generated from ICD-10 codes. And so we wanted to make sure that hospitals know that they should be using the AIS ISS score as it is more accurate than the ICD-10 score. So we wanted to make sure that they were aware of that. So those are 2 updates we made. And then our next meeting is on Wednesday, July 21st. So that is all for me.
Hey, Carissa, is that just for level 1, 2 trauma centers for the AIS, or is it for all 1 through 4?
It's for everyone who submits a full data set. So levels 1, 2, and 3 are required to submit a full data set, but there are some level 4 centers who choose to submit a full data set. So it's any facility who uses AIS codes as well as ICD-10 codes.
Okay. Any further questions for Carissa? Thank you very much. Let's turn then to the Trauma Program Manager workshops. Heather Miller.
Hi, Dr. Gaither. So we had a Trauma Program Manager workshop in June. There was a lot of people in attendance. They covered a lot of different topics, from masking to trying to get back in person to do meetings, as well as the Arizona Trauma memberships for critical access hospitals. The Center for Rural Health had paid for those facilities to help with education. They're trying to work on getting more people on TEPI to listen in due to all the updates and the good information that's on this meeting. So they're working with the Trauma Registry and trying to get trying to get a TCAR course. There's currently one in Tucson in September. So those were the highlights of that meeting.
Thank you very much, Heather. Any questions for Heather? All right, let's move ahead then to the EMS Registry user group. Raymond.
Morning, everybody. A lot of the stuff on here, it should go pretty quick. It's kind of been covered by Ann and a couple of people, so we're going to cover it really quick. So the EMS Registry Users Group met on April 19th, covered a bunch of the new personnel in roles, such as the new Bureau Chief, Rachel Garcia. Julia Vin is now the Time-Sensitive Illness and Injury Manager. We just heard from Mrs. Carissa Wilson as the new Trauma Registry Manager also. The other big one was there is now the first in a series, some 2-hour webinars focusing on image trend elite systems as far as data and run form configurations. Everyone will be receiving an email when part 2 is out. We also covered the EMS data dashboard, which we went over earlier today. Also, ET3 is currently being piloted by about 14 entities in Arizona. I'm sure everyone's familiar with a few of them. I believe Surprise Fire, Mesa, AMR, a couple of them are all doing that. And the big thing that was talked about from Ann was the data going directly to CMS and trying to get that data to AZ peers also. So I guess that was the way it's set up. So they're currently working with some of the pilot agencies to make sure that data comes over. We already covered the premise agency standards with the greater than 90% by March 1st, and covered that and did a great job covering that earlier, along with showing actually, the amount of agencies that already meet that. The other thing that was covered was the weekly and monthly data schedules. Also, agencies making sure they get those runs per month, validation rule violations report. As we know, they come out every other with a 2-week delay, so they come out weekly. So you can see that. My department's a PAP, so I've used them to kind of work with my vendor and work with Anna also to make sure we get that score as high as we can. The other big one was, again, we talked about earlier, was the data set moving to the 3.5. Like I said, Ann covered that great. Some of the big highlights between moving from the 3.4 to 3.5 was the big ones that we covered at the meeting was trying to get the changes, just covering the changes to cardiac arrest elements as far as getting them to align with CARES and SHARE a little better. And as far as ones that are being altered, removed, or added, if anyone is interested in seeing those, covering them, the actual minutes have actual clickable links and stuff like that where you can actually see all those as far as which ones were changed, moved, and everything like that. And then the other big one was just covering the whole NEMSIS descriptive UUID, which is a universally unique identifier. And this is kind of like a coding which will basically be attached to either a location, a facility, a vehicle, device, personnel, EPCR, and it doesn't change. So utilizing those. And I believe that was about it. And then I believe there was a suggest for a review of Article 9 data elements and how they'll align to future NEMSIS codes. So if there's any other questions, that's what will be covered.
Okay. Thanks very much, Raymond. Any questions? All right, that ends our updates. Next, we'll turn to agenda items. Any call for agenda items for the next meeting? Please feel free to let us know now, or you can reach out to Shelley and we can work on reviewing your agenda item. Let's turn to a call to the public. Any public comments? On this somewhat rainy Thursday morning, everybody is quiet and happy. We'll take it. All right, upcoming events. There's a 4-hour virtual traffic incident management training course, a Western Pediatric Trauma Conference, and a Southwest Trauma and Acute Care Symposium on the list. You can see there at the bottom of your meeting agenda. Any other upcoming events? Okay. The next meeting will be November 18th, 2021, knock on wood, in person. And with that, can I have a motion to adjourn the meeting?
This is Raymond Pro with a motion to adjourn.
Thank you. First, how about a second?
Allison Lopes, second.
Okay, thank you, Allison. And with that, we will go ahead and close the meeting. Meeting is adjourned. Thank you all for being here today. Look forward to seeing you in 15 minutes for the next one.
Thank you.